Endometriosis is a condition where some of the endometrium, which is the lining inside the uterus, for whatever reason makes its way outside of the uterus into the pelvis. And when it does that, when your ovaries signal your uterus to have a period and contract, those endometrial glands contract in places they're not supposed to be, and they can cause really painful periods for women. Typically, women will talk about having a lot of pain right before their periods start, and then during their period it's very painful. Also, sometimes women will talk about pain with intercourse, especially with deep penetration, and sometimes it can progress to even just pain all of the time if it's been going on for a long period of time. So oftentimes people will come to a gynecologist because their family practice provider has referred them for painful periods, or even sometimes women will just refer themselves for having painful periods, and we sit down and have a conversation first. Oftentimes we'll do a pelvic exam, sometimes we'll do an ultrasound of the pelvis just to see if there's anything else going on. And when we've kind of ruled out other causes of painful periods, then we kind of end up narrowing down oftentimes to endometriosis. Technically, to diagnose endometriosis, you have to see it and remove it, so the diagnosis officially happens with a surgery. So oftentimes we'll do a surgery to look and see if we can find it, and then hopefully also treat some of the pain by removing the endometriosis. Treatment options can span from medical management, so sometimes we'll put people on just a regular birth control pill or hormones that can help regulate and prevent those painful periods from happening. And surgical options would be where we do a laparoscopy, so a surgery through small incisions to be able to see endometriosis and then remove those lesions as long as they're in a safe spot to remove. And that oftentimes provides a lot of pain relief for women.